Well, Delhi is reporting 11,491 cases and 72 deaths in the last 24 hours. This is the highest ever since the pandemic began. The positivity rate in the national capital is at a worrying 12.44%. This is the highest deaths that the national capital has recorded since the 5th of December last year. Delhi's chief secretary held a review meeting and has given directions to ensure that every family with a COVID case has a pulse oximeter, and also given directives to create a 24/7 cell in 11 hospitals of Delhi. This as 14 private hospitals, including some of the top hospitals in the city, have now been declared as full COVID hospitals and have been directed not to admit any non-COVID medical surgical patient until further orders. 3,202 beds have now been dedicated and reserved for COVID patients across these 14 hospitals. Well, let's take a look at vaccination. On day 2 of the Tika Utsav, there were more than 37.63 lakh vaccine doses that were administered till 8 p.m. last night. Over 10.82 crore doses were administered across the country so far. Sukirti, who's been tracking the details of India's vaccination drive as well as the COVID story, joins us at the moment. Sukirti, worrying story at the moment as far as COVID numbers are concerned. This is not just an urban phenomena, worrying also to see cases rising in rural pockets. The vaccine dissemination has picked up pace. And of course, good news coming in terms of the Sputnik 5 vaccine being granted emergency use authorization as well.
Well, yes, definitely good news on the vaccine front with approvals for Sputnik V coming in. And as my colleague Vishnu Shom spoke to the RDIF CEO, the chances are that those Sputnik V doses might be rolled out somewhere in early May in India. So good news on that front. But of course, worrying news coming in from the national capital, which has recorded over 11,000 cases, and also 14 big private hospitals that have now been declared COVID dedicated. We are standing outside one such hospital, which is Max Super Speciality Hospital in South Delhi's Saket. Max has 2 other blocks as well in this entire premises. Those will continue to function for non-COVID patients, but one of their buildings of Max Smart has been declared COVID dedicated. Similarly, certain branches of Fortis, Apollo have also been declared COVID dedicated. Up to 3,000 beds across these 14 big private hospitals will now be meant entirely for COVID patients. But what does this mean for the common man out there in Delhi, for COVID and non-COVID people who are trying to get an admission into the hospital? Let me simplify it for them a bit at this point. While these hospitals are yet to receive the internal notification, what we are hearing from the hospitals at this point is that no new admissions will be taken at these 14 big private hospitals for non-COVID patients. So one point is that. Apart from that, non-COVID patients who are already admitted in these hospitals, what happens to them? Now, the hospitals say that people who are almost on the verge of recovery, they will be discharged. As far as moderate patients are concerned, at least the bigger private chains like Fortis or Max might try to shift these patients to the other branches which are still functioning for non-COVID patients. As far as the more severe patients are concerned, their situation will continue to be monitored, because we have to understand this is a medical issue, so patients can't simply be thrown out if they are in a very intense condition. So based on the condition of the patient, of course, there will be efforts that will be made to discharge the patients or shift them to other branches. So this is bound to cause a lot of inconvenience to the public in the upcoming days, and even today, as soon as the notification is received and things are implemented on ground, there are problems that a lot of people, just because there is a pandemic does not mean that other diseases have disappeared. So a lot of people who are coming for surgical procedures as well are bound to face difficulties.